Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
The shoulder. We're finally going to talk about the shoulder. It's a shallow ball and socket joint with actually a remarkable range of motion. And because the shoulder joint is so mobile, it tends to be more susceptible to injury. Shoulder pain can stem from a lot of different causes, including sprains, strains, tendinitis, or an injury to the rotator cuff, that group of tendons on the top of your shoulder that allow you to move it so far in so many different directions.
Conservative treatments such as rest, ice, and physical therapy are sometimes all that's needed to recover. But if your injury is severe and it involves a complete tear of the muscle or tendon, you might need surgery. Here to discuss shoulder problems and what to do about them is Mayo Clinic orthopedic surgeon Dr. John Sperling. Welcome back to the program, Dr. Sperling. It's great to have you here.
Wonderful to be here. Thank you so much.
My colleague, Dr. Sperling, good to have you with us.
Wonderful, Tom. Thank you.
So tell us why it is that the shoulder joint can move so far in so many different directions.
That's right, Tom. It's incredible the range of motion the shoulder has compared to other joints in the body, but along with that range of motion comes more susceptibility to injuries, particularly when people perhaps overdo it with activity or sustained falls or things such as that.
Most common injuries?
Most common injuries are partial tears or full thickness tears of the rotator cuff, a very common injury that we see.
All right. Now, a lot of people come in and they say, I got a problem with my rotary cuff. It's rotator cuff, right? And tell us what that is.
But you know what they mean.
That's right. That's right.
Yeah.
Exactly.
It's like my prostrate.
That's right. So it is, Tom, the partial or full thickness tears are incredibly common. So getting tearing of your rotator cuff is like getting gray hair, losing your hair, or both as we get older. So an incredibly common problem that we see in folks. And some people tolerate them, and some people it causes significant pain, particularly at night when they try to sleep.
A question that I have about that range of motion that we were talking about when we got started. If, as you age, you don't do enough stretching or strengthening of the shoulder, do you lose that range of motion?
People as they age do lose range of motion. It's a great question. So over time, most people do lose some motion in their shoulders. So maintaining flexibility and strengthening your shoulders is important as we all get older.
So the rotator cuff, this group of tendons on the top of your shoulder, it degenerates with time or it can tear?
Correct. So as we get older, they fray. The rotator cuff tendons do fray with aging and time, and they do become more susceptible to injury. There's no question about that. So perhaps a fall that you would take when you're younger, the rotator cuff can sustain that or do okay with that. As we get older, the tendons do tend to weaken, and they're more susceptible to have a full tear.
Can the tear ever repair itself?
It doesn't. It's interesting. So a rotator cuff tear is like a hole in a pair of pants. It does not heal itself on its own. We try to treat these, and particularly in people who may be a little bit older, with simple non-operative things at first, medication, injection, physical therapy. But people, if they have continued pain despite that, that's when we think more about operative intervention.
Because the rotator cuff is less like a muscle in that way? Because can a muscle repair itself?
So the rotator cuff is actually the part where the muscle turns into tendon and the tendon inserts into the bone. Okay. So typically what happens is the tendon actually rips off the bone. Oh. So there's actually a real gap there between the tendon and the bone, and the tendon itself cannot heal itself back to the bone that way, particularly when there's a full tear.
And tell us about the surgery. Can you do that through the scope, and how successful is it?
It's interesting. It's really come a long way, Tom. So in the past, there were these horror stories of going through shoulder surgery and the pain and disability and how long the procedures would take. But most rotator cuff surgeries really are amenable to either an arthroscopic repair or a repair through a small incision. And the surgeries typically take about an hour to do. Many are done as an outpatient or perhaps one night in the hospital. So it's come a long way in terms of the surgical technique to minimize pain.
So you can sew the tendon, repair the rent in the tendon or the tear in the tendon, or sew it back to the bone?
Correct. So it depends where the tendon tears. Sometimes it tears in the tendon itself. Usually it's the tendon off the bone, and we can usually repair that arthroscopically with 3 or 4 little 1 centimeter incisions, or perhaps one incisions about 1.5 inches, 2 inches on the top of the shoulder itself. So smaller incisions, less post-operative pain the patient will typically have.
Outpatient surgery?
Outpatient. So most times in the United States, this is done as an outpatient, or perhaps in some patients, we keep them one night in the hospital for pain control, but it can be done either way.
Before we move on to talk about other shoulder issues, how can you prevent injury to your rotator cuff?
It's a great question. I think there's no true proven way to prevent that. Again, it's part of the aging process, and many times it's sustaining injuries. So many of the people that we see are people who fall on the ice in the wintertime, sustain injuries out on the farm, people who have injuries. You add the injuries along with perhaps an aging rotator cuff, that's usually the recipe for getting a full tear.
And what's the success rate for rotator cuff surgery, and who is not a candidate?
So the success rate is very good. It's probably 85-90% of people get a good outcome. I think the recovery takes a while after a repair.
Like weeks?
It can take weeks or months, or some people say it can take 6 months to a year to determine your full recovery after a repair. So it takes a long time with physical therapy after the procedure itself. But thankfully, most tears can be fixed surgically that way. The tears that can't be fixed surgically, in the past we had no other treatment option. And perhaps we'll talk a little bit coming up about some newer options we have, such as shoulder replacement for those folks.
So there are some that you just can't repair. It's too extensive, or tendon too degenerated, or?
Exactly, Tom. Those are tendons that perhaps have gone on for a long time, that have larger tears that are no longer repairable. There are some options now, particularly the reverse shoulder replacement has revolutionized our ability to take care of people who had massive cuff tears or non-repairable tears, and now there's a treatment option to be able to help those people.
What about itises? Let's talk about itises.
Yes.
The list of them that I have has got bursitis and tendonitis at the top of that list, and that can just really wreck your day. And all it is like, it's just a sharp pain that you have all the time.
That's incredible. I think it's in the top 5 or 10 most common diagnoses to see your doctor. Cough, upper respiratory tract infection, and also bursitis, rotator cuff tendonitis is in the top 10 also. Thankfully, that can be usually treated with those non-operative things that I mentioned, injections, medication, and for the large majority of people, 90-95%, that will go away with time with those simple treatments.
A couple of other things I want to ask you about, and they're related to injuries to the shoulder. And tell us the difference between a separated shoulder and a dislocated shoulder.
Yeah, great question. So a dislocated shoulder is when the ball slips out of the socket joint completely. That's a true dislocation. A shoulder separation is epidemic here in Minnesota with people slipping on the ice. That's when you separate your clavicle from your acromion bone. That's a shoulder separation.
How can it not damage your shoulder to do that?
It's interesting, when people fall down, they typically fall on the point of their shoulder, the outside part of their shoulder. And another group, we see it in our hockey players.
Right.
When they get checked into the boards and they come into their shoulder low, what can happen then is the collarbone, the clavicle bone, separates from the acromial bone, the roof bone, and it pops up that way. So we see that very, very commonly. Again, thankfully, most of those can be treated non-operatively, but boy, they do hurt a lot in the initial period.
Yeah, so that's just right on the top of your shoulder where your collarbone meets the scapula, this portion of your scapula called the acromion, and it's only held together with ligaments. And you hit it on the side and it pops those ligaments. Sometimes it's a minor injury, sometimes a major injury. You don't always have to operate on that, though, do you, even if it's a complete tear?
That's correct. We've learned over time most of those, thankfully, can be treated non-operatively, but again, incredibly common, falling off a bicycle, slipping on the ice, hockey, things such as that.
What's a frozen shoulder?
A frozen shoulder is a shoulder that gets stiff. So another term is adhesive capsulitis. So it's a thickening of the lining of the shoulder itself, and an inflammation can be an incredibly painful problem, and that stiffening. We see it more with people who have diabetes or an endocrine disorder, but some people can just develop it for no reason whatsoever.
Is it equal to when I have a super stiff neck because I slept wrong and I can't move my neck? Is that the same thing that's happening in a shoulder, a frozen shoulder?
It's a great analogy. Very, very similar to that. And the way we try to treat those now are injection, but very gentle physical therapy. I think in the past, we used to treat those very aggressively with therapy to say, well, geez, just fight through the pain. One thing we've learned in the shoulder is more pain does not equal more gain.
Huh.
So very gentle.
All right, we are talking with orthopedic surgeon and shoulder specialist Dr. John Sperling. We've hit the common shoulder problems pretty well. Time for a short break, but when we come back, we're going to talk about arthritis of the shoulder and shoulder joint replacement. He's one of the world's experts. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are talking with orthopedic surgeon, shoulder specialist, Dr. John Sperling. We've been talking about common shoulder problems, and now let's talk about arthritis, because there are a lot of people with arthritis. Most of them are a little bit more advanced in age, but you've got a solution for it, right, Dr. Sperling?
I think we have some very good options for folks now. That's right, Tom.
How many people have arthritis specifically in their shoulders?
It's a great question. So it's actually pretty common. And what had happened in the past, people were probably undertreated for it. So actually the rate of shoulder replacement surgery is growing at 3 to 4 times the rate of hip and knee replacements.
Really?
In the United States. So the rate has really increased. And I think that's due to better technology and easier recovery for our patients now, and more recognition that there are good options available out there to help patients.
What really happens when you have arthritis of the shoulder?
So it's like a tire on the car. You wear all the rubber off the tire and it becomes metal against the road, and then you start wearing down the rim, you start wearing down the bone. So many people over the course of their lifetime, through hard work or just aging, wear down their shoulder joint, and they develop really debilitating shoulder pain. Shoulder pain is so difficult because it usually occurs at night and disrupts people's sleep, so it becomes very disabling for patients.
So really you've worn out the cartilage that lines the ball and the cartilage that lines the socket. So you got bone rubbing on bone.
Exactly.
And if your family members had arthritis in the shoulder, are you more prone to have arthritis in the shoulder?
Great question. I've seen it in some families, perhaps, where I've operated on 3 or 4 different brothers in one family at a younger age. There probably is a genetic component of it that we have not yet discovered. For most people, it's just wear and tear with age over time.
And what can you do about it?
Well, the shoulder replacement is probably one of the areas where we've made the most advancements, because in the past we heard these horror stories of people being in a sling for months and months at a time, long surgeries, but a shoulder...
I was just going to say, which is why people probably didn't often have surgery for their shoulder. They just kind of learned to deal with the pain.
That's exactly right. It's probably one of the reasons that people were hesitant to come to the doctor's office for it to be evaluated. Typically now a shoulder replacement is a 1-hour surgery. It's 1 night in the hospital, an arm in a little soft sling for 3 to 6 weeks. All the stitches are absorbable, and most people do all their physical therapy on their own at home with a family member. So it's come a long way in terms of what we used to do in the past.
How'd you get so good at this? How many of these have you done?
I've probably done about 4,000 or 5,000, so lots.
Practice.
One trick pony, Tom.
So,
that's it. That's
you
right.
know, there's more and more people that I know that are getting their hips replaced at a much younger age. It makes sense that the same sort of technology can be happening for shoulders, that people don't have to live with that pain anymore.
That's exactly right. So I think that the options really are better now, and I think as primary care physicians and other orthopedic surgeons have seen that, better outcomes, that patients are more likely to be referred in for treatment for this and able to benefit from some of these treatments.
And what's the recovery like? You said it's easier than it used to be. Obviously, the surgery is fairly quick, and you're in the hospital one night or totally outpatient?
One night, and it's interesting. Most shoulder surgeons would actually tell you that the pain of going through a shoulder replacement is less than a rotator cuff repair.
Really? No.
It
No, sometimes, I'm sorry, finish the rehab part of that.
So the therapy is done on your own at home. The stitches are absorbable. And with the shoulder replacement, for a reason we don't quite understand yet, again, the pain is typically less with a replacement than a repair. Many people are off the pain pills within a couple days, some longer, but the recovery is usually very reasonable. We now, Tom, shoulder replacement similar to a hip. It's actually easier to go through a shoulder replacement than a knee replacement now in terms of pain.
Now, what do you do in the instance where you not only have the arthritis, so the joint is worn out, but also the rotator cuff is bad? The rotator cuff is torn or torn off the bone, and so they have limited motion. What do you do in that instance?
That's probably now the number one indication for surgery for shoulder replacement. Interesting is a combination of having a rotator cuff tear plus arthritis. And for that one, we now do the reverse shoulder replacement.
Reverse?
Reverse.
You put it in backwards?
We put it in backwards. We actually put the round ball where the cup used to be, and we put the cup where the ball used to be. And what that allows is the outer muscle on the arm, which you can feel on the outer muscle of your arm.
The deltoid muscle, right on the side and the top? Okay.
To actually elevate your arm. So it's come now, there's more reverse shoulder replacements done in the United States than regular ball and socket replacements.
No kidding.
It's amazing, yes.
More reverse than conventional.
More reverse than conventional.
And it's because so many people who have arthritis of their shoulder also have rotator cuff disease. Is that the reason?
It's the primary reason, plus it's expanded the indication. So we do reverse shoulder replacements for fractures, bad fractures around the shoulder. We actually do reverse shoulder replacements for people who have no arthritis. Their shoulders are not worn out, but they have a massive rotator cuff tear that can't be fixed. So it's the first replacement of a joint where you're actually not, the indication or the reason to do it is not the arthritis, but it's the rotator cuff tear or a soft tissue problem. Very interesting.
No kidding. Well, who figured out how to do this backwards?
It was actually a French surgeon about 30 years ago had this crazy idea to go ahead and to reverse the ball and socket joint. And at first he was ridiculed for the idea. And then over time, we've really recognized the brilliance that this French surgeon had, and now is really spread throughout the world.
And how much does a shoulder replacement surgery cost? Do you have an idea? I mean, I know it varies around the country, but in general, and it's paid for by Medicare if you're over age 65, is that correct?
Correct. I would say my own personal practice is largely people in their 60s, 70s, and 80s. So my practice is the majority of people I take care of, I think the average age is mid-70s. So the cost is probably equivalent to a hip or knee replacement.
Well, and as the population ages and people want to stay active, because they want to stay active, don't they?
Yes.
They do. I would imagine that this...
You'll find out pretty soon.
That's what I know. I would imagine that this is something that people take pretty seriously, but I am thinking right now, if my shoulders are good, everything's fine, how can you keep your shoulders healthy and keep those joints? How can you keep arthritis at bay? Are there any preventative types of things you can do?
Yeah, another great question. There's nothing proven to prevent arthritis of the joint. So there is no proven, but I think what we do see are people who really bounce back quicker from the surgery are in overall better health. So maintaining a good health, maintaining the flexibility of your joints and strength, all those things help people in the post-operative recovery period.
Does your rotator cuff ever wear out without a history of some kind of significant injury?
It can. We see that actually quite frequently, Tom, where people can never recall a specific injury that happened, but just over time they've noticed a gradual increase in an aching pain in their shoulder region. And then many people are frankly just very tough, have lived with this for a while and haven't realized it, and they finally come to the doctor's office and their rotator cuff is really severely torn.
And do you have arthritis in both shoulders then, or can you develop it in just one?
The majority of people that I see do have it in both shoulders.
Mm.
And do you are you doing more women than men, or is it pretty much equal?
It's actually more women than men. My practice is the majority women. I think it's just based on life expectancy.
Oh, they're living longer.
They're living longer. So the average patient who actually I take care of is usually a woman who lives alone at home. So the shoulder replacement, one of the nice things is it really helps them maintain their independence.
Are you saying that we should finish up? All right. Everything you wanted to know about shoulder replacement surgery from one of the world's experts, orthopedic surgeon, Dr. John Sperling. Dr. Sperling, thanks so much for being with us.
Thank you for allowing me to be here.